roles and functions of the Department of Health. Tama? Please acknowledge.
Oo, sir, dira,
Yes,
sir.
sir. Yes, sir.
Okay.
Yes, sir.
So again, just a little bit of a power review. So again, presenting to everyone the roles and functions of the Department of Health. So as we have mentioned or as we have discussed sa previous meeting, as I have mentioned, may tatlo ka main role and function ang inyong Department of Health, namely leadership role, enabler or capacity builder role, which talks about improvement, and your administrator role, which focuses on the supervisory function of the Department of Health. So sa IA leadership role, as we have mentioned, one of the powers of DOH there is to formulate ang paghimo sa mga bago nga polisiya kag programs to advocate for the health of or to be an advocate of the patient and to regulate, of course, every facility and every product involved in the Philippine healthcare delivery system. In the enabler or capacity builder role, which talks about the power of the Department of Health for improvement of services. So, pwede siya dira ka-innovate, ka-update, and pwede siya dira ka-monitor sa hospitals, specifically sa public sector, and to ensure quality health sa tanan nga mga residents or tanan nga mga community members or the Filipino people. And in the administrator role, which talks about the supervisory function, pwede siya dira kahatag emergency services such as those in the ER to manage specific hospitals, specifically ang tanan nga national level hospitals like your national hospitals, your regional hospitals, and your specialized hospitals. And dira pwede siya ka-administer sang basic services. So, amo nang inyong roles and functions of the Department of Health. So, as I have mentioned, pwede nyo na summarize into LEA, which has, what do you call this one? FAR, IME, and EMA. So, I hope there are no more questions when it comes to the roles and functions of the Department of Health. So, we will proceed with the elements of Formula 1. So, we have discussed earlier di na tong Formula 1 to nagkadto. So I have presented to you what Formula 1 is. So let's try to see the elements of Formula 1. So aside from what do you call this one? Aside from Formula 1 or the four critical interventions, may elemento nga nagapalibot sa iya with Formula 1. So that is in the mnemonics nga BRE. Okay? So every time you see elements of Formula 1, you have to remember BRE. So BRE stands for ang Formula 1 nga nga ginhambal naton, which is your Go-Go Fires. It is geared towards the achievement of letter B, better health outcomes. Number 2, mas maayo nga delivery system, meaning to say much more responsive delivery system. And letter E, much better nga equitable financing. Since in order to upgrade the delivery system or in order to ensure quality service, kinahanglan man may quality nga financing because those financing institutions or the financing agency will be the one to cover the expenses. So kung mas maayo nga ang pag-improve sang mas maayo nga palisiya, programa kag mga services sa healthcare delivery system means to say mas maayo man or mas improved man nga financing. Because kung hindi mo pag-i-improve ang financing, wala sang kwarta para ibayad sa mas maayo nga policies and programs. Okay? So this will basically talk about the improvement of PhilHealth. Since PhilHealth is the agency that is responsible to finance health services. So, equitable financing talks about the improvement, revision, and reforma sang PhilHealth to be at par or magsunod sa mas maayo nga delivery system or mas manami nga mga programs and services for health. Okay? So, before we proceed to discuss more on primary healthcare, balikan taanay ang mga contributions ng mga iba't iba nga mga Philippine presidents when it comes to health. Para mabalaan ta which specific programs ang naghalin sa mga specific nga mga president. Okay? So of course, we will start with the most controversial, Ferdinand Marcos. So in the Marcos era, no, natawo ang gintawag naton nga LOI 949, which basically or primarily talks about the birth of primary health care sa Pilipinas. So it was on the time of Marcos, okay, nga natawo or naidala sa Pilipinas ang ginatawag naton nga primary health care through LOI 949 class, which basically was the mandate kumbaga for the implementation of primary healthcare. Okay? So since naidala ang primary healthcare sa Pilipinas, so may ara na kita sang kumbaga health program which is primary healthcare, kinanglan mo sang health agency nga para in charge or amo na ang mapadalagan sang imo nga health program. So since may ara na kita health program, kinanglan ta ang health agency dira na tawo kumbaga nagsanga formally ang aton nga Department of Health. Okay? And of course, it was on the time of Ferdinand Marcos nga napatindog ang iba't iba nga mga national hospitals, not PGH ha, iba't iba nga mga specialized hospitals because it was the project of Imelda Marcos nga mapatindog ang Philippine Kidney Institute, ang Philippine Lung Center, and all those specialized hospitals. Not all ha, but most of the specialized hospitals was or were projects of the Marcos administration, specifically Imelda Marcos, okay? Which was of course, or ano tawag sini? Which was of course nagsanga or nagtawo because of money, okay? Or because of kwarta sang tawo sang Pilipinas, okay? So although we give credit to them kasi sila ang nagpatindog or nagpatayo sina and projects ina nila, but of course the question would be is diin ina naghalin ang pagpatindog sina. Of course it was still from the money of the Filipino people. Okay? So that was the major contribution of the Marcos administration. Specifically ang primary healthcare because it was Marcos nga nagdala sang primary healthcare sa Philippines. Okay? Number 2, we have Corazon Coangco Aquino. So, Cory Aquino, ano ang contribution ni Cory Aquino when it comes to health? Of course, after sang diktadorya nga regime ni Marcos, ang nagbulos as we know from the People Power Revolution is Cory Aquino. So, ano ang naubra ang na-contribute ni Cory when it comes to health? Okay? So, wala sang major, okay? Wala sang major program or advancement when it comes to health. Because of course, sa panahon ni Cory Aquino, they were focusing sa paglimpyo and pagbangon ng Pilipinas from the dictatorship of Marcos. But however, one of the most important contributions of Cory was the LGU code or ang ginatawag naton nga RA 7160, which was the devolution code of the Philippines. Now, let me try to review a bit. What's the importance of RA 7160 to health? Ano ang importansya sang LGU code? As I have mentioned or as we were discussing the Philippine Healthcare Delivery System, ano ang importansya sang RA 7160 sa health? Guys, anyone from the class, anong importance or ano ang importansya sang pagsanga sang LGU code or sang devolution code of the Philippines to health?
Sir,
Sir, bali,
Go.
sige, ikaw na.
Go. Go ahead, sino to?
sir, bali sila ang responsible ba sir nga mag-deliver sang care nga halin I mean sa isa ka a certain community officer sila ang responsible sila sir mag-handle, mag-control sir.
Ang LGU. Aside from that, sa origins gid mismo sang RA 7160. Ano ang importansya sang RA 7160? Anyone? Any more answers? Discuss na niya. I have mentioned this sa inyo. Ano ang importansya? Why is RA 7160 important sa health? Because it is through RA 7160 nga nagsanga ang ano, nga nag-divide ang ano. Wala na. Anyone from the group?
Dili, sir, gi-improve ang mga services, sir.
Aside from that, ang origin gid mismo, like the start, the very beginning. As I have mentioned sang una, sining ko sa Philippine Healthcare Delivery System, di ba? Sa aton Philippine Healthcare Delivery System, di ba nakatunga sa dua, public and private, and then ang public nakahati sa national and sa local. Anong importance ng RA 7160? Ang balko sa inyo before, okay? As I have mentioned before, sang wala pang RA 7160, tanan kita or wala sang local nga healthcare delivery system. Because everything before was under the national. Di ba? Tanan nga public before is national. So everyone or everything was directly under the Department of Health before. But because of RA 7160, nagsipak, no? May nagsipak. Okay? From the national level, nagsipak ang inyong local level. So natawo ang ginatawag naton nga LGU. So it is sa LGU nga natawo ang aton nga local healthcare delivery system. Now, anong importance? As I'm trying to ask again, what's the importance or the significance sang pagsipak sang local delivery system to the national healthcare delivery system?
Sir, ang municipal kag provincial. Sir. Sa local.
Aside from that, so di ba duha dire, we have municipal and provincial. Aside from that, ano pagid ang importansya sang RA 7160? Amo na gani, di ba natunga or na-divide, nagka-devolution kumbaga. So everything now is not under directly the Department of Health, but however, nagsipak ang local government units, ang inyong local healthcare delivery system. So anong benefits amo na lang na ano ang manami kung may kita sa local healthcare delivery system and not everything is directly under the Department of Health?
Dahil sir, ang pag-spread sa information sa mga malayo
Aside
nga
from
mga
information, hindi lang
Nagaan nila
Access, sir.
okay, aside from access, ano pa?
nagaan nila sir sang na-address concerns sang different certain community.
Ano again?
Na-address nila ang different concerns or needs sang certain community.
Alright, okay, good. So, ang kanya-kanya nga mga problema, ang kanya-kanya nga mga needs and concerns or issues sang mga kada komunidad, no, mas madali ma-solve and mas madali makapangita sang solutions for those problems because the power now is on the local government units. So they have the authority and they have the power to formulate their own programs, to formulate their own policies when it comes to health. So hindi na kinanglan nga ang problema sa komunidad kumbaga ipasa pa sa Manila kay Department of Health kag si Department of Health pa ang mas ngita sang solutions for the problems sang local nga community. Okay? Because amo na before sang wala pa sang RA 7160. Sang time ni Marcos, okay, amo na ha. Sang time ni Marcos ang wala pa RA 7160. So ang aton nga Philippine Healthcare Delivery System nga nagahatag sang inyo primary healthcare was of course natunga sa public and private. But however, okay, ang public nga niho, everything is national kumbaga. National tapos panaog sa national nakadto sa manaog na sa region, then manaog na sa province, okay? Then manaog sa municipal. So healthcare, ang delivery sang healthcare sang una under the public sector is centralized, meaning to say everything is directly ginapasa kag ginahaboy sa DOH. Okay? So amo na kung may problema diri sa pinakadalom sa laylayan ng lipunan, okay? Ang problema sang municipal or diri abi sa RHU, ang mga programs or mga services diri wala yan nagahalin sa mayor, wala nagahalin sa governor, ginahulat pa from the Department of Health. Okay? So kung ano man diri let's say may outbreak di abi, may epidemic di sang isa ka sakit. So reportan pa na pasahon pa na sa province, ipasa pa na sa province sa region, ipasa pa na sa region sa central office, and then ipasa sa central office sa Department of Health. Then ang Department of Health, manumdum pa na, makonsult no whatsoever, ibalik sa central office, ibalik sa region, ibalik sa province, and ibalik dito sa RHU. Amo na gani siling ko kung muna ang sundon ta nga proseso or sistema, patay na ang tawo dino sa municipal level bag-o pa baton sang serbisyo. Okay? Ang tanan nga hulag is centralized. Okay? So in the time of Marcos, amo pa ni ang healthcare delivery system. So as diri sa mga probinsya, hindi pa damo masyado diri ang mga programs and mga policies kumbaga, not compared didto sa central or sa NCR. Kay ang pagpasa sang program services information tanan-tanan is centralized. Okay? But of course, as I have mentioned, sang nagpungko si Cory, sang natawo ang RA 7160, okay? Sa natawang RA 7160, mas madali na subong mabaton sang mga communities ang mga programs and services kay wala na silang nag-aasa sa DOH kundi ari na ang power sa LGU. Naintindihan ko dito? So ano ang mas manami? Ang parehosong una, sang wala pa RA 7160 nga centralized or may local government unit?
Ang may LGUs.
Ang may LGU. Again, nga man. O gusto ko masabat nga man, may manami nga may LGU.
Para mas dali, sir, ang concern, sir, nga sila na mismo manumdum wala, sir. Para ang care is madali na mahatag sa pasyente wala.
Okay, so that's the benefit or that's an advantage. Pero ano ang disadvantage sang local government unit kung siya, or I mean, ano ang disadvantage ng local healthcare delivery system kung sa LGU ang power and authority? O, balantang advantage sa muna maayo, sir, nga may muna kay mas madasig, mas makahimo sang programs, mas madasig ang pagbaton sang mga services kag policy sa mga tawo. Pero ano ang disadvantage? Of course, may disadvantage. Ano ang disadvantage?
Finance, sir.
Aside from finance, ang LGU may kwarta, gindi na. Ang local government unit may kwarta, ina sila nga man because income generating ang LGU. So ano ang income sang isa ka banwa? Okay, ila na. That's the power of the local government unit. So let's say for example, ang isa ka syudad, isa ka munisipyo, tanan nga mga kita nila sa tax whatsoever ila na ina. So bahala sila kung ano na nila ang ilang kwarta. So hindi ta maghambal nga problem ang finance. Ano ang isa ka disadvantage? It comes with management.
Poor distribution, sir.
Aside from distribution, aside nga man poor ang distribution.
Corruption,
Okay, so sino ang origin din galing ng corruption? Sa mga
Leader man, sir.
Okay, sa mga leaders. So amo na ang one disadvantage, politics. So manami na tani nga we have faster healthcare delivery system, faster delivery of services, faster nga innovate kag pag-update sang mga healthcare services because lang sa local level. But however, the disadvantage is the leadership because the leaders involved are politicians. Then therefore, health that was supposed to be or health that is supposed to be politically neutral is now becoming politically active or politically involved because ang leader sang healthcare delivery system gapon is a politician. Okay? So whatever is kumbaga the sistema niya or ano man niya, for example, ang programs and services man niya mismo sang politician, amo na ang mabaton sang tawo. So kung ang politician niya is very, very politically affiliated, then therefore ang health services man of course, pwede ta ma-expect nga politically affiliated man. Amo na ang disadvantage because it relies on the leader. Okay? Not compared yang sa central nga you have just one leader which is the health secretary gid. So diriya sa local level, the leader is not a member of the health department, but however a politician. Of course, under sa politician nga na, we have doctors, we have, di ba may local, as we have mentioned, we have our local health board. But however, everything is gapon in the power and the authority of the politician, which is the mayor and the governor. So, amo lang ng isa ka disadvantage. Kumbaga, ang health services and programs nga ginabaton sang tawo, subjective na. Nga man, it depends on the leader, on the current leader. Kung manami man niya ang leader, like for example, I'll give a very good LGU. Okay nga, sa mga dagkong LGU, exempted na kita di. Because gamay lang kita. Sa mga dagkong LGU, give one leader abi nga which is sikat nga ginapuri, nga ginapraise subong.
Vico, sir.
Very good. Pasig, Vico Soto. So, amo na, whatever is ang nababaton man niya sang Pasig nga, Pasig gid man. Tama no? Pasig or Pasig.
Pasig,
Pasig,
Whatever
sir.
sir.
is
Yes,
ang
sir.
services and policies nga ginabaton sang mga taga Pasig is because of the efforts of Vico Soto. Okay? Like compared to, for example, ano pa ba ang Quezon City, Mayor Joy Belmonte. So whatever is nababaton sang mga tao from Quezon is because of the efforts of Joy Belmonte. So amo na, question is, parehos ay nababaton ang mga taga Pasig sa mga taga Quezon? Hindi. So instead of a centralized or a uniform service kumbaga or policy and program, it's becoming subjective. Because involved na ang politics. Because the leader is a politician. Naintindihan ko dito? Naintindihan ko dito?
Yes, sir.
Right. Okay, but still of course, maayo gyapon and the bigger advantage there is that mas dali na mabaton sa tao ang services and programs because the healthcare delivery system was kumbaga devolutionized kumbaga amo na. So there is now power and authority sa local government unit. So mas dasig ma-address ang mga problems, mas dasig makahimo solutions, mas dasig makahimo sa mga programs. So mas dasig man mabaton sang tawo ang healthcare delivery system. So that's the very big advantage of RA 7116. So that's under the Aquino administration. So kadto kita for Fidel Ramos, President Fidel Ramos basically has no program for health. So kung ano ang nag-update diri from Cory, amo man gyapon ang nagpadayon pakadto kay Fidel Ramos because Fidel Ramos, as far as my knowledge or my extent reaches, Fidel Ramos has focused more on the international relations of the Philippines. So, kung ano man ang health from Cory, nagpadayon lang. Okay, wala update. Nagpatuloy lang. Now, next is Joseph Ejercito Estrada. So, in the Estrada administration, one of the major contributions or one of the what do you call this one, new or innovations when it comes to health is that ang DOH from primary healthcare lang solely nagka-reforma ang ilang health agenda, no? So from DOH nga solely purely primary healthcare lang nagka health sector reform agenda. Mas nag-improve kumbaga ang health sector reform agenda through the Formula 1 for Health nga ginatawag naton, which contains your Go-Go Fires. So it is through the Estrada administration nga ang aton nga Department of Health from primary healthcare lang has made one step further. Nagka-reforma ang iyang agenda, iyang health agenda. So nagka-Go-Go Fires, nagka-Formula 1 for Health kita. That's under the Estrada administration. Okay? Next is for Gloria Macapagal Arroyo. So after Estrada was Gloria Macapagal Arroyo. So of course, padayon man diri gyapon may ara na sang health sector reform agenda, may Go-Go Fires na. Ano pa ang naidugang ni Gloria when it comes to health? RA 1775, okay? Which is our National Health Insurance Program. Okay? So our RA 1775 kumbaga, okay? The National Health Insurance Program or the advancement, okay? The updating, okay, or ang pag-improve, okay, kag pag-regulate sang aton nga PhilHealth. Okay? So it is through Gloria nga nag-improve, nag-update, okay, ginreforma man ang PhilHealth. Kaya ang PhilHealth amo nang nagagasto mo kag nagabayad sa healthcare services nga ginabaton sang tawo. Okay? So RA 1775, that's the National Health Insurance, or which talks about the improvements or the innovations to PhilHealth or the National Health Insurance Program. Sang RA 7 sang kay time ni Gloria Arroyo natawo kumbaga ang RA 1775, which is ang pagpangalan sa PhilHealth as the National Health Insurance Program. Okay? Which is siya na ang government agency, which is I think a GOCC, which is primarily or solely responsible to be the national health insurance, okay, of the Philippines. It is through Gloria nga natabuin na. And another contribution of Gloria was the 4-piece program. Okay? So it is through the Arroyo administration nga natawo ang 4-piece program. And 4-piece, as we know, kung 4-piece member ka, automatically you will have benefits from PhilHealth. So that's one of the major contributions of Gloria to Health. So these community residents who were approved or who were fortunate enough to be members of the 4-piece program can now benefit from the benefits of the National Health Insurance or PhilHealth. So that's one of the major contributions of health from the Arroyo administration. We go to next. After Arroyo was Noynoy Aquino. So padayon man gyapon from health sector reform agenda to pagkatapos ng 4P, so on and so forth. Now, what Noynoy did was to further improve pagid. So from the health sector reform agenda, okay, gindugangan niya, which is now the Aquino Health Agenda, which was the goal of the Aquino Health Agenda is to achieve universal health care. Okay? So, universal healthcare is kalusugang pangkalahatan. Okay? So, the goal of the Aquino Health Agenda or ang pagreforma pagid. Diba? Sa time ni Estrada, ginreforma ang health agenda. Sa time ni Aquino, ginreforma pagid ang reforma ng agenda ni Estrada para mas ma-improve pagid ang healthcare service. Okay? And that's the goal of Aquino Health Agenda, universal healthcare. Ano ang universal healthcare? Kalusugang pangkalahatan or health in the hands of the people. Okay? Ang level abis na, di ba, from primary healthcare, ang primary healthcare basic services lang. Kung i-improve mo ang primary healthcare, magiging universal healthcare. Now, ang primary basic lang, okay, locally available lang. Ang universal healthcare, comprehensive and universally available. Okay? So, anong difference from locally available to universally available? Ang locally available, kung diin lang mismo, specifically, contained, okay? Local lang. Kang universal, biskan diin ka pa, makabaton ka, that's universal. Okay? Biskan diin ka pa, biskan ano ka pa, regardless of class, division, whatsoever, makabaton ka. Okay? That's universally available. So that's better than primary. Okay? Or than basic. Nagigets ko? So that was the goal tani of Aquino Health Agenda to achieve that what we call nga universal healthcare. Nga ang services for health is not just locally available but now universally available. Pero wala na nila na-achieve. Okay? Na-achieve inayas ang time ni Duterte. Okay? So now, let's go to the inclusions pagid sang Aquino Health Agenda. So under the Aquino Health Agenda, okay, di ba? So, ang HSRA ni Estrada, gin-improve pagid ni Aquino. So, ang iya nga Formula 1 for Health nga Go-Go Fires, gindugangan duha, which is your HIS and your HHR. Okay? So, your health information system and your health human resource was added to the Formula 1 for Health. So, hindi na siya subong 4, naging 6 na ang Formula 1 for Health. Okay? Pero Formula 1 mangyapon ang tawag sa iya. And another contribution of Noynoy Aquino is RA 10606. Okay? Under the RA 10606 is another amendment to PhilHealth or the National Health Insurance Program. Now, this time to include indigenous peoples. Okay? So now, before, okay, sang time ni Gloria sang bago ang PhilHealth, wala pa sang category nga indigents. Okay? So, under the Aquino Health Agenda or under or the Aquino administration, gindugang ang kategory nga indigents sa PhilHealth. So, ang aton nga mga Filipino residents nga mga indigenous people or who belong to indigenous communities, like aton mga tribo muna nga mga Pilipino. So, they now have free access to healthcare benefits from PhilHealth. Because under PhilHealth benefits or category, may indigent category na which is free. Okay? So free na, wala na sila nagabayad. Like for example, kung mga ati ka or you belong to whatsoever nga tribo, okay, automatically you belong to the indigenous PhilHealth. So wala ka mo da nagabayad. That's free. So sila, nakakabato na sila now subong sang mga benefits for health. So they have access to healthcare, they have access to medicine, they have access to hospitalization na. Okay, so that's one of the good things or the advantages or contributions of the Aquino administration to health. Now, however, one of the disadvantages or one of the what do you call this one, negative things worth remembering in the Aquino administration is that si Noynoy Aquino ang presidente nga nag-veto. Okay, veto is to cancel or to reject what do you call this one, a legislature. Okay, the president has a veto power. Ang veto power is the power of the president to reject a legislation. Okay, a legislation comes from the legislative body sa aton nga what do you call this one, Congress and House of Representatives. Sila ang gobra batas, di ba? Sang law. Okay? So in ano gani ang term ni Aquino 2016 natapos. In 2016, okay? Sang 2016 may ara na naipasa, na aprubahan sa legislative body sang aton nga government which is sa Congress, sa Senate and sa Congress. I mean with the House of Representatives. So na-approve na ang bag-o tani nga ginatawag naton nga Comprehensive Nursing Act of 2016 which is bag-o nga nursing law. Okay? Because our previous nursing law or ang nursing practice class sa Pilipinas, guess abi ninyo kung ano pa nga year ang ginasundan. Last update to the Philippine Nursing Law was saan pa? Search nyo. Last atong nga current nursing law in the Philippines. Ano pa nga tuig ginobra? So meaning to say ang compensation bala ang bayad sa nurses, ang aton nga mga scope of practice, aton mga ethical standards mga muna was sang ano pa nga tuig ginasunod.
2002, sir.
Very good. Sang 2002 pa because the last update to the nursing law was 2002 pa. Now, do you think kinanglan na inabaguhon 2016 na kinanglan na baguhon? Yes. On the Comprehensive Nursing Act of 2016 tani, okay, dito ang bag-o nga salary grades ng mga nurses, ang bag-o nga scope of practice mas comprehensive na kumbaga, mas damo na kita pwede himuon. Okay? Like for example, mga IV muna so mas damo na kita, mas comprehensive na ang scope sa aton nga practice. So update na ina sa nursing profession. However, it is Aquino nga nag-reject or nag-veto sa Comprehensive Nursing Act. Because para sa iya, I think it was 2 weeks before the last day of office ni Aquino. Okay? 2 weeks before natapos ang Aquino administration, ginveto niya pa ang Comprehensive Nursing Act. Okay? So because I think the primary reason for him is that unfair kung pasahan niya or aprubahan niya ang Comprehensive Nursing Act kay unfair sa other nga mga healthcare workers like medtechs, radtechs, doctors nga taasan ang bayad sa mga nurses. Because para sa iya kumbaga kuno abi hindi lang nurses ang healthcare workers. So unfair nga taasan niya ang nurses lang. Okay? So bagsak, lumagbong ang Comprehensive Nursing Act back to zero kita subong. I don't know kung di na subong liwat sa legislature ang Comprehensive Nursing Act. Siyempre, sang natapos ang Aquino administration, bago naman ang mga senador, bago naman ang mga Congress, bago ng House of Representatives. So, another hearing naman from the first hearing, second hearing, whatsoever, asa maabot sa president. Okay? So, sa iya tani, iya na lang pirma ang kulang, ma-approve na ang bago nga update sang nursing law. Whatever gin-veto niya. So, back to zero kita. Asa subong wala pa na ma-approvehan. I'm not sure kung di na ina. I think wala na subong gin reading. I think ara pa lang siguro sa lower house. Not sure sa upper house basta wala pa siya or tunga-tunga pa lang sa. So nag-back to zero. So that's one thing worth remembering in the Aquino administration. So hindi kita dilawan para hambalon ta or purion ta siya, no. We are commending the good things kana obra niya, but we are also criticizing the bad things kana obra nila. Okay? Next is now the current administration, Rodrigo Roa Duterte. So in the Duterte administration, one good thing worth mentioning here is the 10-point economic agenda. Sa Duterte administration, Abe, by 2022 or by 2030, okay, may aras ang ginatawag nga NDP kita or the National Development Plan. Okay? The major focus or highlight of the National Development Plan of Duterte sa iya 6 years bilang nga termino is the 10-point economic agenda. Okay? Which contains, I think, number 6 in isa, number 4, nilipat lang ko, is the Build, Build, Build program. Okay? So, Build, Build, Build program, kumbaga, focuses on infrastructure development, building of bridges, building of airports, seaports, terminals, tanan-tanan. Okay? Yung infrastructure, what do you call this one? Technological buildings, mga centers, whatsoever, that's under the Build, Build, Build program. Because more infrastructure, more income for the Philippines, more workforce, more trabaho para sa mga Pilipino. So that's a good thing about the Build. More hospitals, more facilities for healthcare, 'di ba? That's under the Build program. So that's one of the good thing. Aside from that is the responsible parenthood law ang atong RH law bala, RH bill before RH law. So si Duterte ang nag-approve sang RH law, which consists of course as improvements to what do you call this one? What do you call this one? Lang, hindi ko ma-formulate. Ensuring that Filipino parents or Filipino couples, kumbaga, is practicing responsible parenthood, which tries to focus on the adjustment of birthing gaps or birthing spaces. Nga, ang point bala sa RH bill is, ang ianak lang dapat sang mga mag-asawa is ang number nga kaya nila suportahan. So that includes like safe motherhood programs, ng what do you call this one? Family planning programs whatsoever. So actually naging effective ang responsible parenthood because sang time nga before the pandemic 2019 nubo ang aton nga teenage pregnancy muna because of the responsible parenthood or the RH law. So mas informed na subo ang mga kabataan about contraception, like family planning whatsoever. But sang nagka-pandemic, nawasak ina. No? Kaya since everyone is, so, anong tawag sini? Mas more ang time sa mga bata sa balay, wala na sila nagabalik sa eskwelahan. So, they're more like at risk for premarital engagement or premarital sex. So, mas damo sang pandemya nagbululusong. Okay? So, because of more time compared nga ara sila sa eskwelahan. Okay? And a significant thing pagid worth mentioning sa Duterte administration is ang universal healthcare. Okay? So, ang una nga nag-try implement sini was in the Aquino administration, but it is through the Duterte administration nga natupad or natawo ang universal healthcare law. Okay? So, anong ara sa universal healthcare law? Ang manaming sa universal healthcare law, because as we have mentioned kagina, universal healthcare means kalusugang pangkalahatan. Okay? So, ang kalusugang pangkalahatan means ang basic healthcare services hindi na lang locally available. The basic healthcare services are now universally available, so that means they are accessible to all Filipinos. Okay? So, ang basic healthcare abi or ang primary healthcare abi sad to is locally available lang. Meaning to say, RHTU level lang or kung sino lang ang members ng PhilHealth, amo lang ang makabaton sang basic services. Pero ang universal healthcare, tanan na nga tawo regardless of kung diin man siya or ano man iya or ka-contribute man siya sa PhilHealth or wala, can now have access to basic healthcare. That's universally accessible or universally accessible nga healthcare. Okay? So anong ibig sabihin sang nagtawo na ang universal healthcare? Kung na-implement lang tani ang universal healthcare, okay? Tanan nga tawo sa Pilipinas are automatically PhilHealth members. Okay? So kung tanan nga tawo sa Pilipinas automatically PhilHealth members, regardless if indigent man sila, bata man sila, gaobra man bala, wala gaobra, or diin man sa or ano man sa whatsoever, PhilHealth member siya. So kung PhilHealth member ikaw, of course, you have access or you can make use of the benefits of PhilHealth for healthcare, for medication, for free hospitalization for all Filipinos. So, amo nang ginatawag naton nga universally available. Okay? What's the difference, again, Abe, between primary healthcare and universal healthcare? Bare recitation, tabial. Pili. Wala may masabat, mapili ko ngalan. What's the difference between primary healthcare and universal healthcare? Anong difference ang basic services nga locally available versus the universally available? Anyone from the group? Silensyo. Anong difference sang primary healthcare sa universal healthcare? Again.
Sa ano sir, sa primary healthcare sir, mga basics na sir kag mga particular lang sir maka-receive. While ang sa
Like ano?
like ang ara lang sir sa ano sir, sa mga sa diin nga lugar lang sir nga available.
Aside from
Tapos
that, ano pa gid?
ang lang sir ako nga ano sir.
Okay.
Clear.
Whilst
Pero while ang sa universal healthcare sir, muna sir pamugina if diin ka man sir nga universalist sir, muna sir makabaton ka gid sir. Amo na ang pinaka dumo namin gid sir sa universal healthcare.
okay, aside from that, another answer. Another answer. Miss Badana. Miss Badana, what's the difference between primary healthcare and universal healthcare? Miss Badana? Sige, Miss Bakulinaw. What's the difference between locally available and universally available? Wala. Mr. Belvis, what's the difference between primary healthcare and universal healthcare? Mr. Belvis?
Sir, for me, sir, primary, sir, just like what Batan said, sir, like mga basics, sir, mga primary wherein kung ang mga needs, sir, mostly nga nag-appear wala, sir, sa community. Kagong universal, sir, mostly tanan, sir, nga tanan nga ara sa tanan, sir, by universal. Dapat nga makita, sir, dong.
Mr. Ligario, what's the difference between healthcare nga locally available and healthcare nga universally available?
Ang locally, sir, ah, statement na lang. Ang locally, sir, ang makabaton kita sang PhilHealth benefits amo na gaya, sir, ang healthcare medications muna kag ang specialization, sir, pwede na sa for example, labi hospital ang may mga hospital sa inyo, pwede mo na magamit ang PhilHealth, sir, sa local.
Okay. Whilst, how about universal?
Sa universal, sir, ang for example, sir, sa COVID-19, sir, hindi man ready-made available, sir, pero benefit para sa tanan, sir, for example, na sang lockdowns and ano pa?
Ano pa?
Ano pa
That's
ganito?
all?
Sir, amo na pag-intindi ko sang
Okay. Sige.
lockdowns and
Good. How about Miss Deslate?
Sir.
Next ikaw. Miss Deslate.
Yes, sir. Batian ko,
What?
sir.
Yes.
Okay. So, ang universally available, sir. So, like daw ini siya, sir, ang rules nga ginahimo sang ano, sir, sang like World Health Organization daw mini aton ginasunod nga standard in terms sa aton nga healthcare. Pero
Okay.
ang ang locally available, sir, like ang aton lang bala diri, sir, sa Philippines, like dabi may mga barangay health center, mga minabala, sir.
Okay. Very good. Next, sino to kaginang before you ano?
Ako, sir, ng ano
Okay.
mo lang, sir, gamay ma lang. So, for
Okay.
me,
Good.
sir, in my own understanding, amo na, sir, miyara, lang sa universal, bala, sir, miyara, kita sang SDG, which, diri nga part, gina-provide, diri ang mga tawo, sang access with a high, essential quality and services to a safe and effective, affordable nga mga medicines. And then, when we say naman sang primary healthcare, this is miyara kita, 'di ba, sir, usually mga local kag mga multiple sectors like ang mga lapit lang bala sa balay nila, sir,
Okay.
which go work together to bring the care closer sa home sa mga tawo, sir, muna ang sa local, sir,
Okay.
for me.
Very good. Okay? So kung i-combine ang tanan yung nga answers, that would be kumbaga the totality of what primary healthcare or universal healthcare is. Okay? So going back, gusto ko i-reinforce to ang hambal ni Miss Deslate with WHO. Okay? Pag naghambal kita nga universal healthcare, okay, the standard of care or ang care nga programs, services, and policies are kumbaga internationally ang standard naton. So hindi na lang kumbaga pang basic, okay? Although basic man gapon siya, pero the standard is now international in line with the universal healthcare or in line with the WHO, in line pagid asambal ni nga sa SDG naton with the sustainable development goals. Pero they are aside from standardized na sila, ang availability nila is also universal, which is made available na to everyone, okay? Regardless of the location, of indigency, of residency, of status, of whatsoever. Okay? So that's universal healthcare versus sa primary healthcare, nga which is just the basic services nga locally available lang. So basic services like consultation, emergency, medications, amo lang na are readily available sa community. So sa isa ka munisipyo, dapat may ara lang sang pwede pa check upan, pwede baklan bulong, pwede pamangkutan or kadtuan when it comes to health, pero hindi siya internationally standardized kumbaga as compared to universal healthcare, which is a higher step or a higher level of healthcare. Okay? So since locally available lang ang hambal naton sa PHC, ang PHC is locally available because ang makabaton lang sa iya are those kumbaga members or beneficiaries of the financing agency of primary healthcare, which is PhilHealth. So kung hindi ka member sang PhilHealth, hindi ka makabaton sang free nga services or hindi ka makabaton sang basic services. Pwede ka kabaton pero bayaran mo. Okay? Hindi ka beneficiary. Whilst kung mag-universal healthcare na, aside from standardizing the quality of health, it is universally available na to everyone. So amo na gani hambal ko sa inyo sa universal healthcare law, this means ang pag-improve sang healthcare naton as in line with the WHO international standard na of care, mas kumbaga mas one step further ang healthcare, hindi na basic. So mas damo na mga programs or mga damo na sang pwede ma-access on the, imagine nyo kung universal healthcare na, mas damo ka na pwede ma-access on the RHU level. Hindi lang consulta, hindi lang whatsoever. Kumbaga, base gani sa RHU, may, amo na, for example, pas standardized, abi nga tanan ng RHU, may ara na sang birthing clinic. So, hindi lang tanan ng RHU for consult lang. So, pwede naka-anak dito, pwede naka-NGT, pwede naka-IV dito. So, amo na ang universal healthcare. Okay? Now, universally available kay since kung tanan na nga tawo members ang PhilHealth, tanan nga tawo, biskan diin ka pagabayad ka man PhilHealth or wala, okay? Pwede ka nakabaton sang free nga services nga na. Okay? Sang free nga basic services lang, of course. Hindi man niya opera. Opera is not basic service. So, kinanglan na niya sang bayad. But however, may ara man compensation or packages for that. under sa PhilHealth. Okay? However, sa universal healthcare naton, although gina-approve siya, di ba? So, hambal ko, tanan nga tawo is automatically members na sang PhilHealth. Pero however, paano kita nga mga nagaobra, di ba, gabayad kita sang PhilHealth? So, kita ya, nga mga working citizens or residents, mabayad tayo gyapon contribution. At tulang ya nga sa dalom nga mga wala nagaobra, mga bata, for example, mga indigent people or indigent communities, nga wala trabaho, wala whatsoever, sila, biskan hindi sila magbayad, automatically members sila. Pero however, kita nga mga nagaobra, mga professionals, so kita ya mabayad kita gyapon. So medyo on our part, medyo do wala lang pinagbago. Pero sa ila ya on our part, so healthcare is now universally available na. Not only for us lang nga mga may kaya, but also for them nga mga wala gani gid before, hindi gid maka-access before healthcare. Okay? So, amo na tani ang manami sa universal healthcare. So, since approved na ini sang 2019 ata ang universal healthcare, so does it mean nga member na kita tanan subong sang PhilHealth? Hindi pa. Okay? Kay sang time tani class nga implement ng universal healthcare law na dusmo ang PhilHealth, which is ang responsible para mag-finance tina. Okay? So, nadusmo ang PhilHealth kay nagka-scandal sila with their billions of pesos nga ginpangbuaya, so subong nadulaan sila kwarta. So since nagpangbuaya sila sang kwarta, may ibayad pa sila to finance or support universal healthcare. Kaya imagine mo, tanan nga tawo, member na sang PhilHealth, so tanan nga tawo, makabato na sang benefits sang PhilHealth. So tanan nga tawo, kung magpo-hospital, bayaran sang PhilHealth. So, since nagpangkurakot sila or nagpangawat sila sang kwarta, makabayad sila sang universal healthcare? Sabtan nyo ko, yes or no? Hindi. So, ang matabo subong sa universal healthcare may implement sa hindi.
Hindi, sir.
Hindi. Okay? So, as of now, wala pa ma-implement ang universal healthcare because gina-focus subong sa gobyerno nga rehabilitate pabangunon liwat ang nadusmo nga PhilHealth. So, nadulaan sila sang kwarta kay ginpangbuayan nila susubong, ginatry naman sa government hatagan sa liwat kwarta para magka-support sila sa universal healthcare gani. Although step by step no, nasa level nga try na naton achieve ang universal healthcare pero hindi pa sa gyapon gid kumbaga ma-implement because ang PhilHealth as of now ginahil pa lang. Okay? Ara pa lang ta sa stage nga ginahil naton ang PhilHealth sa paggadusmo nila. Okay? So, that's universal healthcare. So, as you can see, we are, although we are criticizing the administration of Duterte, but those programs and policies nga worth commending, gina-commend naton sa iya. So, we are not biased. We are not, in terms of education, no, we are not biased. So, kung ano ang matuod, amo nang gina-share, kag ginahambal ko sa inyo. Okay? So, wala ko sa may ginatabunan. So, as you can see, although gina-criticize naton ang mga administration, pero all the benefits or all the good programs nga ginahambal nila, gina-commend naton. So, ginapaintindi ko sa inyo nga there are good things, there are things or programs nga worth commending, and there are things nga worth criticizing. Okay? So, that's education nga gusto ko ma-deliver sa inyo. Okay? Since we're talking about administration and government. All right, so those are the contribution of the Philippine presidents to health. Okay? So, diri man, okay, since Ari, hindi pa rin natin matapos ang kay Duterte, wala pa natapos iya termino mo hasta pa siya 2022 nga mamuno sa aton. So, hindi ta mahambal nga amo lang niya na obra. Okay? So, when it comes to wala pa na di sa COVID. Okay? So, pag abot sang COVID, o kamo na bahala mag-judge kung ano ang program ni Duterte when it comes to COVID-19 response. Okay? So kung may ara man siya sang program or policy nga ginhimo for COVID, di botang ta na dire after his administration nga worth naton commending or criticizing whatsoever it is. So whoever will be the number 8 no nga president, make sure kamo as registered voters and as healthcare professionals na kamo na ang next nga healthcare professionals mo, you only have 2 years. 2 years na lang, kamo naman ang magiging professionals nga ma-duty sa hospital or kamo naman ang mga workforce nato nga ginatawag So whoever is the next administration, kamo ang magiging sole beneficiaries. Kay kamo na ang next nga generasyon nga maubra mo. So make sure panumduman nyo gid mayad kung sino man na ang igusto nyo in number 8, okay? Especially subong nga nakita nyo naging highlight subong ang health, di ba? Naging highlight subong ang health, nakita nyo kung paano tratuhon ang mga healthcare workers, kung paano i-compensate ang mga healthcare workers, kag kung paano hawiran ang healthcare sa Pilipinas in the time or in this current administration, especially sang nagtapak ang COVID-19. So, kung gusto nyo or if you are passive, for example, or wala ka mo pakialam, for example, sa kung sino ang butuhon nyo on or sino ang mapungko on the next administration, and ang gusto ko lang i-remind sino, tandaan nyo na lang nga 2 years from now, kamo na ang magiging healthcare workers. So kung kalain man ang magpungko, whoever is it man, okay? Kung kalain man or manami ang magpungko on the next administration, ang COVID hindi pa madula. So health will still be as a center of attention or a highlight on the next coming years and on the years nga kamo na ang magiging healthcare workers. So kung, for example, kung kalain man or whatsoever man ang programs and policies sang bagong administration, kamo ang mabatsag sina. Okay? So if you want a good healthcare program in which kamo man ang mabenefit kay kamo ang healthcare workers, then you vote for whoever you think is ang kandidato or whoever you think is the person nga makabulig sa aton, especially kita nga mga healthcare workers. Kay hindi ni matapos on the coming years pa. It will extend and it will continue to extend because hindi na siya madula. Okay? So, hindi nyo paghayaan nga ang, kumbaga, ang kalain, ang mamuno, kay base kung ano ang na-experience subong sa mga healthcare workers, base ma-experience nyo man. Kaya muna na, ang gusto ko panumduman ninyo as of now. Okay, so let's go to the preventive approach when it comes to health. So we have health promotion activities, of course. So in order to prevent diseases, we need to promote activities nga are health promoting. So these health promotion activities or activities nga naga-enhance sang resources that are directly directed at improving the health and the well-being. Disease prevention activities naman are activities directed at preventing a problem before it occurs by altering or by removing factors, okay, reducing exposure and susceptibility of individuals. Okay? Health promotion activities include diet, include exercise. Disease prevention activities are those, kumbaga, nga modifications to the environment, okay? What do you call this one? Removing of the factors of possible means of exposure, like wearing of face mask and face shield. That's disease prevention. Drinking of vitamin C's and multivitamins is health promotion. Nagigets ko dito the difference between health promotion activities and disease prevention activity. Nagigets ko dito? So again, like for example sa COVID, pag naghambak kita nga wear face mask, wear PPE, social distance, that's disease prevention. Because gina-alter mo ang imo nga risk of susceptibility and gina-reduce mo imo level of exposure. Whilst ang pag-inom mo sang vitamins, okay, pag-exercise mo to boost your immune system is health promotion. Because gina-enhance mo ang imo nga resources, which is your immune system, in order to improve your level of well-being. Para ma-promote mo imo health. Okay? Nagigets ko? Okay, now, I think we have discussed this before, but a little bit of a review lang. The levels of prevention. So we have different levels of prevention, level 1, level 2, and level 3. Level 1 prevention lang is primary prevention. So primary prevention talks about prevention of problems. I-prevent natin ang problems before pa sila matabo. Okay? So example of that is immunization. So mapa-immunize ka para hindi ka magkasakit sang muna nga specific nga sakit. That's primary prevention. Level 2 naman or secondary prevention focuses on early detection and intervention. So, may sakit ka na but what you want to do now is to detect it early para ma-intervenan early man and ma-prevent ang worsening of the condition. So of course, this will talk about diagnostics, laboratory tests. Okay, this will talk about interventions. So when we talk about interventions, of course, dira masulod ang tanan nga mga procedures. Okay, so dira masulod tanan nga procedure, tanan nga intervention, diagnostics, laboratories, so on and so forth. That's secondary prevention. It focuses on early detection. Okay? Whilst ang tertiary naman or ang level 3 naton, tertiary prevention activities, gina-correct naton ang problems, okay? And gina-prevent naton ang complications. So ari dire rehab, therapy, okay? Prevention of complications. So anything that promotes, okay? Okay, anything that promotes optimum level of health, correction of illness, okay? Or prevention of the complication. That's level 3 or that's tertiary prevention activity. As I have mentioned, examples are rehab. For example, enrolling a patient on rehab session post-stroke, okay? So after stroke, gusto naton ibalik ang optimum level of health ng isa ka tawo bisan na stroke siya. So ipa-rehab ta sa, di ba? So that's level 3 because we want to correct the stroke, okay, by engaging in rehab. Okay, therapy. Let's say na bali, okay? So after bali, of course, hindi pa na automatically magbalik sa optimum level ang functions ng isa ka bone. So kinahanglan na sa i-therapy para i-prevent ang complications or i-correct ang deformity or ang whatsoever. That's level 3. Okay, so level 1 again, immunization. Level 2, laboratories, diagnostics, tanan nga mga interventions, tanan nga procedures, tanan nga medications, anything that talks about intervention or anything that talks about dealing or managing the disease. That's level 2. Level 3 focuses on correction of the problems, prevention of the complications, like rehab and therapy, as I have mentioned. Spa, like wellness, promoting wellness, mga spa, mga massage na, that's level 3. Okay? Now, we go to primary healthcare. Okay? So, amo na ning ginahambal naton nga primary healthcare or the basic services that are locally available. Amo ning ginatawag ta nga primary healthcare. So, ano inang primary healthcare? Okay? Per definition, primary healthcare or PHC is essential healthcare. Okay? Pag ginahambal nga essential, basic, kinanglan. Basic na kinahanglan. Okay? Essential healthcare that is based on practical, scientifically sound, and socially acceptable nga mga methods and mga technology. Made, however, dapat man gani, universally accessible to individuals and families in the community through their full participation and at a cost nga kaya nila bayaran. That's primary healthcare. Okay? Now, paano nag-umpisa ang primary healthcare kag paano naabot ina sa Pilipinas ang primary healthcare? As I have mentioned kagina, it was Marcos nga nagdala sang primary healthcare sa Pilipinas. Okay? So primary healthcare was founded in September of 1978 by the World Health Organization and 134 countries. Okay? So 134 countries all over the world nag-participate sa isa ka gathering in Alma-Ata, okay, USSR by the World Health Organization. So didto ang venue sa ilang gathering together with 134 countries. Okay? So the birthplace of primary healthcare was in Alma-Ata, USSR in September of 1978. Ang Alma-Ata, USSR is currently known as your Almaty, Kazakhstan. Okay, Almaty, USSR is now Almaty, Kazakhstan. That was in Kazakhstan, formerly Alma-Ata. Okay? So, the universal goal in the declaration of your primary healthcare is that may ara na health for all by the year 2020, by the year 2000. Meaning to say, hambal sang WHO, ang tanan nga 134 countries nga nag-attend sa pag-declare ng primary healthcare, by the year 2000, maka-achieve na sang health for all. Meaning to say, they have access na to basic services or ining ginatawag nato the essential healthcare based on practically, scientifically sound, and socially acceptable methods made available na sa ilang mga communities. Okay? So, anong ginahambal naton nga health for all nga ni? What does it mean pag naghambal kita nga health for all? Health for all means nga an acceptable level of health para sa tanan nga tawo. Okay? All throughout the world through community and self or individual self-reliance. Because ano ang goal? What is the goal of primary healthcare? To achieve self-reliance. Okay? As will be displayed on the next slide. Okay? So again, primary healthcare was brought to the Philippines by Marcos on October of 1979 through your LOI 949. Ang LOI 949 is the legal mandate of the birth of the implementation or of the legal document for primary healthcare or the formalization of primary healthcare in the Philippines. That's LOI 949. Question sa board exam, who was the first country to implement primary healthcare? It's the Philippines. Okay? So that's one thing worth commending in the time of Marcos. Although I am criticizing the Marcos regime, but one thing worth commending is that sa time sa Marcos administration, one of the good things na nahimo niya is that ang Pilipinas ang una nga country nga nag-implement sang primary healthcare. Because it was only 1 year after the World Health Organization meeting nga ang Pilipinas may ara na yasang LOI 949. Okay? So, that's another information worth remembering. Number 2, essential universal healthcare made accessible. Amo nang ginatawag na nga primary healthcare. Essential universal healthcare that is made accessible or made locally available or kalusugan para sa lahat. Okay? So PHC was established with an underlying theme nga health in the hands of the people by 2020. Okay? So as you can see, sino ang president nga nagdala sang primary healthcare sa Philippines? Marcos. Okay? Ang goal sang PHC, okay, or from the time of Marcos was to achieve universal healthcare by 2020. And by the time nga nag-2020, sinong president? Duterte. And anong na-approve anong na-approve nga contribution of Duterte to health sang 2020 also was universal healthcare. Okay? So that's one connection worth also noting. Okay? Goal. The goal of primary healthcare, as I have mentioned kagina, is to achieve self-reliance. What do you mean to say nga self-reliance? Self-reliance means nga ang individual is reliant sa health niya sa iya sarili. Wala na siya gasalig sa based sa mga programs kag sa mga services, siya mismo as an individual kabalo siya mag-alaga sang iya health. So kabalo sa mag-identify kung may sakit siya, kabalo sa magpangita solutions kag problems para sa sakit niya, and kabalo siya mangita resources kung paano niya i-solve ang iya nga mga health problems. That's self-reliance. Amo na ang goal sang primary healthcare. Okay? And habang sa primary healthcare mandate, paano kuno sang isa ka tawo ma-achieve ang self-reliance? Active community participation. Again, how will one person achieve self-reliance? What's the process? Active community participation. Okay? So again, question ko sa inyo, anong ginatawag naton nga self-reliance? If this is the goal of primary healthcare, what does it mean pag naghaba kita nga an individual achieves self-reliance when it comes to health? What does it mean when one person achieves self-reliance in terms of health? Anyone from the group? What is self-reliance in health? What is self-reliance?
Sir, I want to answer, sir.
Sige, go.
Okay, para sa kon, sir, ang self-reliance, sir, ang mga tao may salig na sa healthcare. So, kung may mga nabatsyagan sila nga sakit-sakit, immediately mas-seek sila care. Submit
Okay,
nila
good.
ila self.
That's one thing worth noting. Okay? So aside from they know what to do or they know how to identify their problems, they know services or they know facilities, okay? They know establishments or settings in which nga pwede nila palapitan to consult or to ask for help when it comes to their problem. So amo na, aside from that also, that's one thing worth noting, ang tao may salig na sa healthcare services and programs. So pwede nila gamiton because they achieve or they have assurance. Okay? They have assurance nga ang mga services are safe and effective. Then therefore, gamiton nila. Okay? Without doubt bala, kung masakit ka, okay, without doubt makadto sa ospital. That's self-reliance because kabalo ka mag-deal sa problem mo. Kung masakit ka, kabalo ka magpangita sang solution. So makadto ka sa ospital. Okay? Because you have assurance nga ang programs and services are safe and effective. Sa community, every word is interconnected. Safe and effective, accessible, available, muna. They are all connected. Okay? Active community participation, self-reliance, they are all connected. Okay? That's one of the major concepts. Good thing nga na-mention mo na with self-reliance. That's included in self-reliance. Okay? So, the WHO in terms of primary healthcare has also identified 5 key elements no to achieve the goal nga health for all. So that includes universal coverage or pag naghabakit na nga universal coverage, you reduce the exclusion and social disparities in health. So universally available dapat. So read out the exclusions and social disparities. So biskan may kwarta kag wala kwarta, equally they can have access. Okay? Regardless of the income, of status whatsoever, regardless of whatsoever, wala ang mga exclusions, everyone can have access to healthcare. That's primary healthcare. Number 2, organizing health services around people's needs and expectations or ang pagreforma sang health service. Public policy reforms or pagreforma sa mga public policies, meaning to say, tanan or all of the sectors gina-integratean sa mga health programs and policy. Okay? And leadership reforms, meaning to say to pursue collaborative models of policy dialogue and increase stakeholder participation para more budget and more financing, okay, for better healthcare programs and policies in the future. So, what are the characteristics of primary healthcare? So, when we mention characteristics of PHC, so kung pamangkuton kita abi, let's say you have a certain conversation with another person from another country. So when you talk about health, for example, makuton niya kabi, what is your primary what is your current healthcare program in your country? So mamangkot masabat ka, of course, in the Philippines we are still in primary healthcare because amo lang na ang aton, hindi pa ta universal. So we have primary healthcare. Kung pamangkuton kita, what's primary healthcare? So primary healthcare dapat are basic services nga accessible or the 5 A's: accessible, affordable, available, acceptable, and attainable. Pag naghaba kita gani accessible, balik-balik lang. Pag naghaba kita nga ang healthcare service is accessible, meaning to say, it is found within 5 kilometers, within 30 minutes of land travel. Okay? Pag naghaba kita nga affordable, healthcare services are free or of at lesser cost. Pag naghaba kita nga healthcare services are available, healthcare service should be available sa tao 24/7. Pag naghambal kita nga the healthcare service is acceptable, paano naton mahambal class nga ang programs and policies are accepted by the community residents, by the community people? How can we say nga healthcare programs and policies are accepted by the tao, by the locals, by the localities? Kung ginaano nila.
Participate sila
Very
bala,
good. Kung
sir.
ga-participate sila or kung ginagamit nila, okay? So para mahambal tang healthcare services are acceptable when it is being used by the people. So kung ginagamit sang tao, accepted na nila. Kay kung hindi mo accepted ang isa ka policy or isa ka program, gamiton mo hindi. Malamang hindi. Okay? And number 5, it is attainable, meaning to say maabot, maintindihan, okay? Makaya i-reach sang isa ka tawo. That's attainable. So those 5 A's are the characteristics of our primary healthcare nga ginatawag. Okay? So in talking about the 5 A's or ang paghambal nga healthcare should be accessible, it should be affordable, it should be available, it should be acceptable, and it should be attainable. One thing worth introducing sa inyo is what we call the butika ng bayan and the butika ng barangay or the butika ng barangay. Okay? So ang butika ng bayan or ang butika ng barangay is our drug stores established by the Philippine government to promote equity in health by ensuring nga kada community or locality may available and may access sa affordable, sa safe and effective, quality essential nga mga bulong. Okay? With priority of course to the marginalized, underserved, critical and hard to reach areas. So ini mga butika ng bayan and butika ng barangay, amo ning mga pharmacies actually that are found in the RHU. Okay? But in other areas may mga sole nga butika ng bayan, okay? I don't know kung may nakita na kamo sini. Basta I think in other days sa aton abi ang butika ng bayan is makita sa RHU. Okay? Butika ng bayan sini nga iya nga pangalan. Pero on other areas, mga malayong areas nga wala RHU, sometimes may butika ng bayan sila. So, inang butika ng bayan, may ara na sang mga readily available nga bulong, ang iban libre, ang iban barato lang. Okay? That is, kumbaga, to ensure nga ang tao may access, okay, sa affordable, available, acceptable, attainable nga mga bulong, okay, and healthcare service through the butika ng bayan and butika ng barangay. Okay? So one thing worth mentioning diri sa butika ng bayan and sa butika ng barangay, as we have mentioned, so amo ning mga drug stores nga gin-establish sa Philippine government to ensure the 5 A's of primary healthcare. So, anong components sang inyo nga butika ng bayan? Ang inyo butika ng bayan class contains one of the programs and services ng PHC, which is the emergency drugs. So, ginhimo ang butika ng bayan to ensure nga tanan nga tawo in all areas dapat should have access kuno to emergency drugs. Anong ini emergency drugs ang ginhambal naton? I think I have shared this to you. So this is your Caripon. Have I shared this to you? The emergency drugs? Wala pa? Wala pa. Okay, sige. So, again, ang butika ng bayan to ensure nga ang tao makabaton sang 5 A's, ang characteristics sang PHC, and to ensure nga everyone has access to the emergency drugs. Ang emergency drugs nga ni, amo ni kumbaga ang mga bulong nga dapat every pharmacy, especially ang mga butika ng bayan, should have readily available stocks. Okay? Because they are emergency drugs. And ano ini mga emergency drugs nga ni? This can be in the mnemonics nga Caripon. Okay? So ano ang una-una nga emergency drugs nga every pharmacy hindi dapat mawad-an sang stock sang mga muni nga bulong, especially ang mga butika ng bayan. Number 1, cotrimoxazole. Number 2, ang pinakagasgas nga antibiotic, ano?
Amoxicillin, sir.
Very good, amoxicillin. Pinakagasgas nga antibiotic. And ang tatlo nga ni are very common, rifampicin, isoniazid,
Paracetamol.
and pyrazinamide. Pyrazinamide. Ining tatlo ka bulongan ni these are for ripes. Anong ripes nga bulong ginagamit
TB, sir.
for? TB. Nga man kinanglan may ara sang ripe sir sa ining RIP nga man kinanglan ara na sila sa butika ng bayan. Because rampant sa community ang ano nga sakit? TB. So dapat hindi mawadaan sila sang stock sang muna nga bulong. Nagigets nyo? Number, ambot na ni letter O, Oresol. Oresol is given for
Diarrhea, sir.
diarrhea, vomiting. Okay, ano ning Oresol nga ni? This is okay, ginatimpla for ano ni? Oral hydration. This is for hydration. May electrolytes ina nga unod ng Oresol. So nga sinuka naganilupot abing isa ka tawo, so or especially ang bata, ang ginapainom siya is Oresol. N is for nifedipine. Nifedipine. Nifedipine is antihypertensive, and NTG. NTG stands for nitroglycerin, for angina, for chest pain. Okay? Pre-heart attack medication. Okay? I think you have MS for this, 'di ba? Ang nitroglycerin is used for angina. Angina or chest pain. How can you say nga myocardial infarction na if the pain is relieved by nitroglycerin or not? Naka mo sa MS? Wala pa? Wala pa. Wala pa? Sorry mo gani istorya.
Wala pa, sir.
Baka muna. Wala pa. Okay, sige. So, di na lang ko pag basta nitroglycerin is for chest pain. Okay? So, muna ako may mga nag-heart attack, so sometimes ginagamit mo ng nitroglycerin because may chest pain. Okay? So, hindi ko na 'to pag-explain basta maludula ka mo sa espiritu niyo. So, these are the emergency drugs. Okay, so your Botika ng Bayan was made by the Philippine government to ensure nga everyone or people in the community have access to these emergency drugs, which are very common na ginagamit. Okay? So that's for Botika ng Bayan. So Botika ng Bayan was used to ensure or was established to ensure nga ang mga tao has access to 5As or to the characteristics or these 5 characteristics of primary healthcare. Wala ko gambal nga muni lang ang only nga gin-establish damo. Pero muni ang one thing, okay? Nga worth noting nga ginobra sang government to ensure nga ang tao makabaton sining 5 nga ni nga ginhambal na, which are the characteristics of PHC. Okay? So after this one, we will discuss the pillars of primary healthcare. Pero I think I have to end it here na. So next meeting, we will discuss the 4 pillars of primary healthcare. And then after that is we will discuss the programs and services, which is ang pinakamahaba. So I may have to end here because base overwhelmed na kamo with information. So I will discuss this na lang on the next meeting. Any questions before I end the class?